Hello everyone, welcome to Beautiful You. I'm your host Graison Foster and thanks for watching. The world of plastic surgery seems poised for innovation once again. How about a facelift without surgery using stem cells? Sound too good to be true? Anti-aging specialists and plastic surgeons have now discovered other sources of stem cells, and they are currently being used for facelifts and facial rejuvenation. While this procedure does not have FDA approval in the U.S., my guest today, board-certified plastic and reconstructive surgeon Dr. Renato Calabria, is doing the procedure at both of his offices in Italy. He also practices in Beverly Hills and Rancho Mirage, California. Dr. Calabria is also the inventor of the one-stitch facelift, and he'll be here to talk about that procedure, along with the traditional facelift and many other areas of plastic surgery. He's known around the world for his expertise and technical skills and has appeared on the Tyra Banks Show, VH1, the CBS News, and been featured in numerous magazines like Glamour, In Touch, and been named a top doc by Palm Springs Life magazine multiple times. He was also named one of the top 10 plastic surgeons in the United States by Ask Men magazine. We'll talk to Dr. Calabria next as Beautiful You starts right now. Dr. Calabria, welcome to Beautiful You.
Thank you. It's fun to be here.
Pleasure to have you here. Okay, doctor, as I just mentioned in the open of the show, you're doing the stem cell enhanced facelift. What does that involve exactly, and what are the benefits?
Well, stem cell facelift is one of those innovations that comes, I would say, every 20 to 30 years in plastic surgery.
Right.
Stem cell has taken the entire medical community by storm, meaning that it's a revolutionary technique and helps in heart surgery, in orthopedic surgery, and so we really don't know actually how far we're going to take this technique.
Right.
Nevertheless, yes, I did the first stem cell facelift in Europe, in Florence, about a month ago, and I'm very excited about it because the technology was born actually in United States, in California, out of UCLA and UCSD. And then since they're applying for FDA approval as we speak, we have been using it in Europe, which has been approved already.
So what would be the benefits then of doing the facelift and incorporating the stem cells as opposed to just a traditional facelift?
Well, again, we know that our fat contains stem cells, and therefore when we use the fat grafting in our facelift, we're already adding stem cell to our face.
Okay.
The stem cell facelift is a new technology which incorporates a device that will concentrate stem cell through a complicated enzymatic treatment. Therefore, if in your regular fat, there are a certain number of stem cells, in the stem cell facelift, they are concentrated up to 10 times as much.
Okay.
So what happens? Two things. One is the fat stays longer. One of the problems about fat grafting is obviously longevity. Right. And it seems to go away about at least 50% of the time. With stem cell facelift, the longevity is much longer. It's up to 80% of the time.
So you can kind of get that more fullness that you need.
And also what it does is jumpstart your regenerating mechanism in your skin. So what it does, it jumpstart your own stem cell to reproduce collagen and elastin. And so this is really the solution that we were looking for many, many years to the facial rejuvenation. So I'm very excited about it.
Very interesting. Well, obviously there's a lot of controversy around stem cells. What do you want the viewers to know that are watching the program today? Because this isn't the controversial stem cell issue.
It's not. There is no controversy about adult stem cells. Right. The controversy is more like embryonic stem cells, which is a totally different issue. With adult stem cells, is basically what we call an autologous grafting. Means we're taking fat and stem cell from your own body and will transfer from one side to the other and concentrate them. So there's really no issue in this sense as far as controversy, as far as embryonic stem cells. So that's what is great about this technique.
Would there be any possible side effects at all if I did something like that?
Right. The side effects are more attached to the fact that in any technique that we're using a filler, we're using stem cells instead of fat, there could be some irregular contouring, there could be some asymmetry, etc. But I find actually with the stem cell that the mechanism by which I inject it, which is a small cannula, is actually much easier to inject it with the stem cell because they're more fluid, they're more malleable. So this is one of the greatest things about the fat. Sometimes it gets irregular contouring and therefore it can be problematic, especially around the eyes and other areas.
So you're going to end up with a better result.
You're going to end up with a better result and also a more lasting result.
What is the downtime and recovery like with the stem cell enhanced facelift? Is it the same?
Well, again, we are in the process of using stem cells in both ways. One, in a traditional way, along with the facelift procedure, which is the one I did in Florence about a month ago. And one is just to using as an injectable, like we're using a lipofilling right now. And with that technique, actually, the downtime is much less because obviously there is no cutting, there is no downtime as far as bruising, but some swelling overall, and so the downtime is really shorter.
How long do you feel that it's going to take before it is approved in the U.S.?
I think we're working, we're collecting data in Europe right now. We're working close with the company that makes this device, and we want to do it seriously. We don't want to jump on the bandwagon and try to sell this procedure too quickly. But we're working, collecting data, and I think within a year, I hope that it will be available in the United States.
And we were talking off camera before we started the show today. You already have patients that are contacting you wanting to come to Italy and have this done, right?
Right, yeah, exactly. We have some patients, some celebrities, and some patients even from New York that will be willing to fly to Florence or to Milan or Rome and get it done, and it's exciting.
Now, every procedure that you do has a unique angle. Let's move on and talk about the brow lift or the endoscopic brow lift procedure that you do. How is that different than maybe, say, what was done in the past?
Right. Again, when I look at the face, I look in a face in a whole. And when I look at an aging process, obviously it happens not only in the lower part of the face, but also in the upper part. And therefore, I like to address all the component of the aging process in the face. And I think the brow it's a component that a lot of time is not looked at properly and addressed properly. A sad look or a tired look gives away your age more than some lines on your lower part of the face. Therefore, again, the trend is more toward less invasive procedures. The brow lift is done now endoscopically, means two small incisions in the hairline, and we use the same technology they've been using for laparoscopic surgery through a camera and a tiny scope, and we'll be able to work through these tiny incisions and elevate the brow in a more natural way without making that long scars that was a trademark of the brow lift in the past, and they're still being used today. So less invasive, more natural, but again, important component of the total facial rejuvenation because you don't want to rejuvenate the neck and leave the eyes alone.
Right, exactly. Let's move on and talk about blepharoplasty, or removing that skin that eventually starts to hang on everybody's eyes as we age. What kinds of procedures are you doing for that?
That's a great question. I think blepharoplasty is one of the most misused procedures in plastic surgery these days. And I can spot anybody had a blepharoplasty. If I walk through a party or I see celebrities out there, the blepharoplasty is overdone and gives that rounder, smaller look in the eye, of the eye that is a the telltale sign that you had plastic surgery. Sometimes even I don't address the eye, and maybe I do a facelift and I leave the eyes alone because I think that gives a more natural look. Now, having said that, I think that a very conservative blepharoplasty is okay, but most of the time I think it's more important to address the brow with an endoscopic brow lift and give a more open look of the eyes than do a blepharoplasty.
Interesting.
And also what I do is on patient that had a blepharoplasty and then have that kind of done look, what I do is I do an endoscopic brow lift and I modify the eye shape to make it more almond shape and return it to a natural, more natural look.
All right, doctor, we are going to take a break. As we go to break, we're going to take a look at Dr. Calabria's office in Beverly Hills. Stay with us as my discussion with Beverly Hills plastic surgeon Dr. Renato Calabria continues on facelifts. Stay with us, beautiful you. We'll be right back. Welcome back, everybody, to Beautiful You. I'm Graison Foster. Beverly Hills plastic surgeon Dr. Renato Calabria is on the show with me today. We've been discussing a brand new facelift procedure that he does in Italy, combining adult stem cells with a vertical facelift. This procedure is not currently approved in the United States, but Dr. Calabria is getting some amazing results. All right, doctor, we had a pretty in-depth discussion about this in the previous part of the show. But I wanted to ask you again, when do you think this procedure will get approval in the U.S.?
I would say within a year. I'm really looking forward. I think we're collecting data right now as far as for our European experience and try to combine it with other centers around the world. And I think we'll be hopefully ready within a year to start some trials here in the States.
Now, I know you brought the results with you of your patient, the before and afters of your patient who did have that stem cell facelift. So we're going to take a look at those now.
The results are more natural. There is a volume restoration in the face. Therefore, it's not just a pull-tight look. And as the patient ages, the stem cell will jumpstart their own regeneration process, theoretically, and therefore, actually, we really don't know the limit of this procedure.
Now, can you do a stem cell rejuvenation to the face, obviously, without having a facelift?
Absolutely, and that's where we are. That's where the trend is going to be toward. We don't have to do. We're using now lipofilling, which is fat grafting, to volumize the face. It means to bring the volume back to the face, which is actually the trend. It's not pulling tight the skin, but volumizing is the key. And we have been using the fat grafting, but with results that are so-so. With the stem cell is much more promising because, again, longevity is much longer, predictability, and also the fact that it will hopefully jumpstart your own regenerative process in the skin and in the tissues below that, and that's what's so promising about it.
I also want to mention that you were the inventor of the one-stitch facelift. Explain that procedure. How does that work?
Well, the one-stitch lift is out of an idea that came when a celebrity was visiting my Beverly Hills office, and when she walked into the examining room, she looked pretty good. So I say, "I'm sorry, I don't think I can help you out."